Good morning, it's Dr. Larson talking about COVID-19. I'm just going to talk about a couple of things today. So our incident rate for the county is going downward. We're still seeing about 20 cases a day as a result of people getting together over the Christmas and the New Year's holiday. But slowly we're coming down we crossed into the 600 range and we're now kind of coming down. For that, our percent positive is still above 16%. So we have lots and lots of positive tests coming through. And probably the biggest news is that we, as of Monday, became part of the South Central region. The governor's restrictions are still in place, and we are now in a new region with our South Central partners, which include Yakima, Benton, Franklin, Walla Walla, Columbia counties. So with that group, we need to meet some metrics in regards to hospitalization, COVID-19, ICU bed availability, incident rates going down, and percent positive. So we're working together with those folks. We did get together with the health officers and administrators of all of those health departments on Monday, and we will be setting up a weekly cadence meeting with them so we can kind of move forward out of phase one. We're currently in phase one of the governor's reopening plan, and if we meet some metrics, we can move into phase two. There are no further phases currently, but I would expect a phase three to come out at some point as we kind of get through the next part of this winter. What I want to talk about is testing. So beside me here is some boxes of testing kits, and I want to talk about testing in schools. So the first part about testing has to do with outside of schools. If you have any symptom of COVID-19 or you have been in close contact with somebody with COVID-19, you should be tested. End of story. That testing, you can have that done at urgent care, you can have it done at some of the physicians' offices in town, and you can have it done at the COVID clinic. There's no cost to those testing at the COVID clinic, so it does apply to your insurance but not to your deductible, and there's no copay. Our return on those tests is less than 2 days now, so we're getting through those testing. What I really want to talk about is testing in schools. So we have had our K through 12 schools open since the beginning of this last school year. As you know, Kittitas started that process, and now all of our schools are open, K through 12 in a hybrid model. To keep these schools open, especially in a situation where we have a lot of disease in the community, is that we have to have some mitigation strategies in place. So we have to be still maintaining 6-foot social distancing, we have to be masking, we have to be hand washing. Those things are the most important things. For those of us that work in schools, we need to be careful of what we're doing outside of school so we don't bring the disease into school. And that applies to both the teachers that are working in schools and also kids that are going to school. So how do we reduce the risk of those people that are in school? We do that with testing. So there's a variety of ways to test. The first testing strategy that we're putting into place is we have been offering rapid antigen testing to teachers on a once-a-week basis. We are going to be getting to the point where we're offering rapid antigen testing to students and staff twice weekly. So that's a big lift for the school nurses to be able to do that. But what that allows us to do is capture those folks that are just becoming to the point where they are becoming infective and getting a positive test result there, and removing that child or those teachers out of school so they're not spreading that disease to others. That, along with the other mitigation strategies of masking, social distancing, and hand washing, has allowed us to keep our numbers low in schools. We've had one episode where we've had transmission in schools, but we've really done a good job. The teachers have done a great job in getting schools through, at least through the first half of school. So we're going to be starting testing in schools, much more aggressive testing. The reason for testing is not to punish anybody who's positive, but to allow us to continue to keep schools open. So your school, each school is going to have a little bit different protocol, but basically we'll be doing testing on a twice weekly basis. We have enough test kits here at the health department to do rapid testing. And then for those kids that are sick, we will do a rapid test on somebody who's ill in a school, or a teacher that's ill in a school. That'll happen from the school nurse. And then if that test is positive, then that's a positive test. That person gets to go home in isolation for 10 days. If it's a negative test and that person is symptomatic, they still need what we call a PCR test. It's a secondary test. We do have test kits available that we will be working out a situation where we can perhaps send those test kits home with parents so they can test at home. But that's still in process. But more on testing. Testing is how we're going to get through this with schools. And the other issue with schools is we are going to get teachers vaccinated. They are currently in phase B2 for most teachers, those teachers that are older than 50, but we are still waiting on vaccination. We're still waiting on more vaccine availability. So that's the key. So social distancing, masking, being careful what we're doing outside of school, testing in schools, and getting vaccinated when you have the ability to get vaccinated. So that's what I have today, and take good care, and we'll talk to you next week. Thanks. Bye.